paper is on impact of contrast sensitivity on visual quality in different types and stages of glaucoma. Coming to the introduction, glaucoma affects over 70 million people worldwide, which is the second most common cause of blindness. It is a group of disease causing progressive irreversible optic neuropathy and leads to degeneration of retinal ganglion cells and loss of the visual field. Early detection and prevention are key to reducing the progression, and the techniques for detecting visual field changes are vital in the glaucoma management. Visual field changes are crucial markers for disease progression and improvement. Goal of the treatment is to preserve the visual function. Contrast sensitivity function is in early glaucoma patients may experience compromised visual quality despite a good visual acuity. Contrast sensitivity is the ability to perceive sharp and clear outlines of very small objects. It is also defined as the ability to perceive minor illuminance changes between the interspread regions not separated by defined borders. My aim is the impact of contrast sensitivity on visual quality in different types and stages of glaucoma. It is assessed using Snellen's visual acuity chart, Pelly-Robson contrast sensitivity chart, and Humphrey visual field analyzer. The study population, after obtaining the ethical committee clearance, people diagnosed with glaucoma who come under the inclusion criteria were taken up for the study. It is a cross-sectional study, sample size is 41, and the time frame is 1 to 1 year 3 months. The inclusion criteria, all patients with diagnosis of glaucoma, glaucoma suspects, normal tension glaucoma, ocular hypertension, patients with visual acuity 612 or better. Exclusion criteria, cataract, posterior capsular opacification, patients with pathological myopia, media opacities, diabetic retinopathy, age-related macular degeneration, and any other retinal pathologies were excluded. Visual acuity was recorded in logMAR values. Contrast sensitivity measured at 1 meter difference using Pelly-Robson charts. Evaluation included Goldman tonometry, gonioscopy, slit lamp biomicroscopy for the anterior segment, and optic disc inspection using a 90D lens. Glaucoma type and severity were determined using slit lamp biomicroscopy and indirect ophthalmoscopy, post-pupil dilatation. HFA24-2 CETA standard program was used in visual field analysis and categorized into mild, moderate, and severe. The results, the study population involved 41 patients, predominantly age group of 51 to 60, with slightly more male predominance, 56.1%. Visual acuity varied with the best recorded as 0.3 in both eyes. Mean intraocular pressure was 24.71 in the right eye and 17.71 in the left eye. HFA mean deviations were minus 10.61 and minus 8.3. This is the graph showing the distribution of subjects according to the type of glaucoma, in which normal primary open-angle glaucoma was the most common type, followed by normal tension glaucoma. Correlations of right eye HFA and CS score shows a positive correlation between the right eye HFA and the right eye contrast sensitivity score, which was statistically significant. And comparing the left eye HFA and CS score, it also shows a positive correlation between the left eye HFA and left eye contrast sensitivity score, which was statistically significant. The scatter plot showing correlation of left eye HFA and logMAR score shows a negative correlation between the two, and the scatter plot showing correlation of right eye HFA and logMAR score also shows a negative correlation between the two. The discussion, right eye mean deviation and right eye contrast sensitivity score has a positive correlation with a P of less than 0.001, and significant relation between visual field loss and contrast sensitivity was seen. Left eye mean deviation and left eye contrast sensitivity scores shows a moderate positive correlation. These were consistent with the studies done by Suhail et al., which was conducted over a period of 8 weeks using a home-based contrast sensitivity testing chart. The results proved a positive correlation between the two, which was consistent with the findings of our study. Another contrasting study done by J. Yong Yang and Yunji Lei study on contrast sensitivity in glaucoma patients. Contrary to the previous assumptions, their findings suggest that the contrast sensitivity does not necessarily correspond to the location of the visual field damage in glaucoma patients. Instead, they observed that the contrast sensitivity was most significantly affected in patients with severe visual field damage, irrespective of the location of the defect. Visual acuity and visual field loss shows a moderate negative correlation in both the eyes. Concluding, correlation analysis conducted in our study revealed important relation between key visual parameters. We observed a negative correlation between the increased logMAR score and mean deviation score, but a positive correlation was found between the decreased contrast sensitivity score and mean deviation score. Eye disorders such as cataracts and other ocular conditions such as retinopathy, age-related and diabetic maculopathy were excluded. These correlations indicate the interdependence of visual acuity, contrast sensitivity, and visual field sensitivity in glaucoma assessment.
Did you include the cases, the glaucoma suspects also in this study?
Yes, sir.
But that is not a stage of glaucoma. It's only a vague terminology. It's our limitation of knowledge. That's it.
Yes, sir. But
Your title says impact of contrast sensitivity visual outcome in different types of and stages of glaucoma.
Yes,
it's
sir,
not a stage of glaucoma.
Sir, even though that was considered as an inclusion criteria, none of the patients were
That I could see in the study, but why was it included? So this is absolutely actually not acceptable as a inclusion criteria, and then not including those cases. Neither
Like ocular hypertensive patients.
yes, ma'am.
no glaucoma suspects. You are writing in the inclusion criteria. You are not including them, and then you are not. It is not there in the title also. So this I think if you present it somewhere else also, then this has to be rectified.